Have you ever felt a sudden wave of dizziness or vertigo and felt certain that it was coming from your neck? It's a peculiar and frustrating experience known as cervical dizziness, and today I'm going to share 9 effective strategies I've discovered that can potentially bring relief from cervical dizziness. Whether it's a simple change in posture or a surprisingly effective old-school remedy, these tips can be life-changing for people with dizziness from their neck. Just a reminder, I'm not diagnosing anyone in this video or offering individual medical advice, but simply speculating on what might be helpful for people with cervical dizziness. All right, let's dive into these 9 transformational strategies that can help alleviate cervical dizziness, starting with one foundational step, improving your posture. You know, it's something so simple, yet often overlooked. Think about how many hours we spend hunched over our devices or slouched at a desk. The weight of our head actually becomes a burden for our neck, throwing things out of balance and potentially triggering dizziness or vertigo from the neck. Here's the trick. Straighten up, bring your neck into a neutral position. Picture it like gracefully stacking one block on top of another and creating a sturdy tower, which is your spinal column. It's that alignment which can relieve pressure and, from what I've seen, sometimes even reduce dizzy spells from the neck. As we move on to our second strategy, let's talk about cold therapy. Trust me, there's something almost magical about the soothing chill of an ice pack on the back of your neck. It's a simple yet powerful act of self-care. You can apply ice on your neck for 15 to 20 minutes at a time, but make sure your skin returns to room temperature in between applications if you use it more than once a day. One of my patients calls this her ice meditation time. It's an opportunity to pause, relax, and calm down her nervous system while she feels the coolness on the back of her neck and calms down the inflammation, settles down the dizziness, and stabilizes the vertigo. Now, on to the third strategy, moist heat. There's something comforting and relaxing that comes with putting a hot water bottle on the back of your neck. Perhaps it can help you with muscle tension or headaches as well. This may end up being your go-to strategy. You can sit back, put a soothing and warm hot water bottle on the back of your neck to loosen up those tight neck muscles. Sometimes this is the only thing I might need to relieve dizziness or vertigo caused by tension in my neck. Let's not forget about the power of self-massage. This is strategy number 4 to get relief from cervical dizziness. Massaging your neck involves releasing muscle trigger points and easing the fascia that connects it all. You know, massage can even help you locate where your body is holding tension. You can use a gua sha tool to scrape a certain painful area, or use a handheld massage tool to work through kinks along your neck, which may be the secret to releasing the stored up tension you've been holding in your neck muscles and restoring your sense of equilibrium. Now, the 5th strategy is medication. I always stress the importance of understanding that while medication can provide relief, it's not a one-size-fits-all solution due to potential side effects. I'll share a bit about my own personal journey using medication to get relief from neck pain. I've used non-steroidal anti-inflammatories like ibuprofen when necessary, and I've discussed other medication options like muscle relaxers with my doctor. It's essential to have this conversation about medications with your own healthcare provider so that they can tailor a plan to meet your unique needs regarding dizziness or vertigo from your neck. The 6th strategy is applying pain relief cream to key areas of the neck. Personally, I keep arnica gel close by. I have one at my office and one near my bed at home. It's a simple staple. Every day I put it on after I get out of the shower. There's something satisfying about putting arnica on those painful spots on my neck and knowing that this can help to reduce dizziness or vertigo from my neck. Many of my patients also have started using some kind of pain relief cream, such as arnica, on their neck. But note a caution here. Always test a new topical cream on your forearm first, just to ensure you don't have any allergic skin reaction. So most of my patients will pick a little spot on their forearm and apply a small dab to be sure they don't have an allergy to a new topical pain relief cream before they'll apply it all over their neck. It's little practices like these that can compound over time, lightening your load of cervical dizziness bit by bit. Finally, let's talk about movement, which is strategy number 7. I know this might sound counterintuitive, but many individuals find that motion actually helps relieve dizziness from their neck. It's like an antidote, shaking off the dizziness. For example, my patients with dizziness from their neck actually report that walking, dancing, doing the elliptical, or just plain moving tends to alleviate some of their discomfort of dizziness or vertigo from their neck. Our 8th strategy is about consulting with a cervical specialist. This step often provides transformation for many of my patients, as well as myself. Cervical professionals can provide invaluable insights and targeted treatments. Imagine finding someone who understands the nuances of your condition and has experience resolving it. They can offer you manual therapy adjustments to your neck bones and exercises tailored to the needs of your own individual muscles and fascia. It's like having a tailored roadmap guiding you back to balance. And our final strategy, number 9, is about digging deeper for the root cause of dizziness from your neck. You see, cervical dizziness can be a symptom of underlying issues that, if identified and addressed, can lead to long-term relief. It's not uncommon to overlook how our daily habits and routines contribute to tension in our neck. Maybe improper ergonomics or certain hobbies, maybe it's your occupation that are keeping you stuck in a cycle of neck pain or discomfort. Even certain positions for sleeping and lounging can play a significant role in recurring or chronic dizziness from the neck. By examining these areas more closely, you might uncover hidden triggers that are deeper root causes to your recurring or chronic neck dizziness. For example, one patient discovered that her favorite hobby, gardening, required postures that strained her neck. By learning new ways to engage in her hobby with proper body mechanics, she reduced her dizziness symptoms significantly. This strategy invites you to become a detective in your own life, piecing together the various elements that might be at play, aggravating your neck over and over. And there we have it. 9 comprehensive strategies to help alleviate cervical dizziness and guide you towards a more balanced and comfortable existence.